Hello, I'm Dr. Cory Lessner, and I'd like to take this opportunity to thank you for choosing our facility for your laser vision correction experience. Over the course of the next 15 minutes or so, we will review pre-procedure instructions, post-procedure medications and activity guidelines, what to expect on the day of surgery, and review the informed consent. At this time, you should have a Millennium folder that contains all of these documents. If you do not, please pause the tape and ask your eye care professional to provide them to you prior to viewing the video. We will first discuss pre-procedure instructions. Please open to this page and follow along. We ask that you arrive at the center promptly at your scheduled time. If you are running late, please contact the center. Wear warm, comfortable clothes. There are no restrictions on eating, drinking, or taking medications before the procedure. However, alcohol and medications which may produce drowsiness should be avoided. You should anticipate being at the laser center approximately 1.5 hours. There must be someone with you to drive you home. You will not be permitted to drive yourself. Carefully remove all eye makeup and do not wear earrings. Please use a fragrance-free soap and avoid the use of colognes or perfumes, as they may affect the optics and proper functioning of the laser. Millennium or your eye doctor will prescribe antibiotic eye drops, which should be started on the day prior to your procedure. Finally, Number 9 reviews contact lens removal instructions. Understand that these are minimum recommendations and more time may be required to produce stability in your prescription. Next, we will review LASIK post-procedure care. Please locate this document and follow along. You will be on 3 eye drops after the surgery. The first is an antibiotic drop designed to prevent infection. As previously noted, your eye care professional will dispense a prescription for this drop. The second drop is a topical steroid used to control the healing process. It appears milky white and must be shaken well before each use. Both of these drops are to be used every 2 hours while awake for the first 24 hours, then 4 times per day for 4 additional days. The last drop is a lubricating drop. This drop should be used frequently while awake for the first 48 hours. After this time, you may use it on an as-needed basis. Use only preservative-free artificial tears. Please be extremely careful not to touch the eye with the tip of the dropper bottle. If you experience any side effects, such as nausea or hives following use of the drops, discontinue them and notify the center as soon as possible. A small vial with several drops of topical anesthetic will be dispensed. This is the same drop used to numb the eye to perform LASIK. Use of this drop should completely relieve the minimal to moderate discomfort characterized by a foreign body sensation, stinging, burning, or tearing that typically improves within 6 hours. Additionally, an oral pain reliever may be used for discomfort. Ibuprofen, aspirin, or Tylenol will almost always be adequate. Do not rub your eyes under any circumstances for at least 1 month following LASIK. Protective shields will be provided to prevent inadvertent bumping of the eye at night. These should be worn for at least several nights following the procedure. You may take a shower or bath, but avoid getting water into the operated eye for 72 hours. Avoid water sports, swimming, hot tubs, and lake water for 1 week. Wear safety glasses for contact sports and work as indicated. No eye makeup should be used for at least 1 week. Do not operate a vehicle yourself for the first 12 hours following your procedure or until you are certain that vision is adequate. Next, we will review what to expect on the day of your procedure. Upon your arrival at Millennium, you will be asked to sign in at the front desk and review for accuracy your patient information form. You will be given a name tag to wear during this time at the center. The tag has information about your eyes and must be visible at all times. After any remaining payment issues are addressed, one of our technical staff will meet with you to discuss any last-minute questions that you may have. If you have numerous questions, please contact the center at an earlier date. This will help to avoid delays and ensure that all questions regarding your eyes have been answered to your satisfaction. Although no longer routinely given, an anti-anxiety medication such as Xanax or Valium is available upon request once there are no further questions and all consent forms have been signed. Please do not take these medications if you have remaining questions, since doing so may invalidate your consents and prevent us from proceeding on that day. Following check-in, if it has not been accomplished on a previous visit to the center, 2 sophisticated color images called orb scans and wavefront analysis or aberrometry and any final preoperative measurements will be performed. Your eye care professional or one of our technicians will then escort you to the pre-op area. It is at this time that you will meet your surgeon and discuss any remaining questions that you have regarding the procedure. You will then be escorted to the laser suite where you will spend approximately 10 minutes. Once in the suite, you will be seated in a reclining chair and given a hair bonnet. Your eyelids will be cleansed with a betadine cleaning solution, and a piece of tape and a shield will be placed over the eye not being treated. Eye drops are used to numb your eyes. There are no needles or injections. A cushion is inflated to hold your head in place, and the chair is then moved under the laser. After hearing the sounds of the laser during an initial test, your eyelashes are taped and an eyelid holder called a speculum is inserted to prevent blinking. You will next be asked to focus on the blinking light located above you in the opening of the laser. Marks are typically placed on the eye to facilitate the exact repositioning of the flap. In the LASIK procedure, a protective corneal flap is created. This is accomplished with the use of an instrument called a microkeratome and is similar to a carpenter's plane. First, a suction ring is centered on the eye. This creates a firm pressure and in most cases makes the vision gray out completely. The keratome then makes a flap of specific thickness. The pressure is turned off and your vision will return. The entire process takes about 20 seconds. This flap is then lifted to deliver the laser treatment. It will cause your vision to become very blurry. Your job will be to focus on the blinking light even though it will appear blurry. The laser itself makes a rapid tapping noise, and most patients will notice an odor similar to a singed hair. This is normal. Typical laser times range from 10 seconds to over 2 minutes depending upon the level of your prescription and the type of procedure that is being performed. Following the treatment, the flap is floated back, carefully realigned and secured in place without the need for stitches. The entire process is then repeated if the other eye is being treated. Patients routinely report feeling more pressure on the second eye. We believe this is due to protective effects of adrenaline during treatment of the first eye. Immediately after the procedure, when you sit up, your vision will probably seem improved but will be very blurry, similar to looking through Vaseline on your glasses. However, visual recovery is rapid, and most patients will see well enough to drive the very next day. After leaving the laser suite, you will be escorted into an exam room for a final examination, given your medication bag in exchange for your name badge, and then released to go home. For those patients opting to have their cornea flap created with interlace, the procedure will be slightly different, since the 2 steps will be performed in different rooms. After meeting with the surgeon, we will bring you into the interlace suite. There, we will clean and numb your eye with topical anesthetic drops. Each flap creation will take approximately 2 minutes. There is a mild pressure on the eye, which is somewhat less than that with the suction of the microkeratome. Your vision will still gray out. At the end of the procedure, you are able to blink normally, but your vision will be extremely blurry. We will then escort you out of the interlace suite and ask you to wait about 10 to 15 minutes prior to performing the laser sculpting portion of your procedure. The remainder of the process is identical to what we have previously described. We will now review the informed consent document. It is our goal to fully inform you about the alternatives, benefits, and potential risks associated with LASIK surgery. It is impossible to have any form of surgery without accepting a certain degree of risk and responsibility. Our consent is designed to enhance your understanding of the potential issues that may be encountered during your procedure and the healing process. The document is divided into 10 sections. After reading each, you will be asked to initial in the space provided. We will outline the highlights of each section. However, after viewing this video, you should carefully reread this document. Please follow along now with your copy and feel free to pause the tape at any time. Section 1 contains an introductory paragraph and general information about the approved U.S. Food and Drug Administration indications for the various lasers found in our centers. Section 2, How the Eye Works, reviews the definitions of nearsightedness, farsightedness, and astigmatism. If you are over the age of 38, you will be given an additional consent form entitled Monovision and Mini-Monovision. This consent form addresses the subject of presbyopia, or the start of reading difficulties which begin to occur in people sometime after their 40th birthday. It is very important that your eye care professional discuss this condition in detail with you. Many nearsighted people over the age of 40 who take off their glasses to read do not understand that they will need glasses for near work or reading after the procedure. Be sure that you fully understand this condition before proceeding with LASIK. Also in this document, the technique called monovision is discussed, a strategy in which one eye is left or made slightly nearsighted to allow for some mid-range and near vision in combination with distance in the fellow eye. Once again, I urge you to thoroughly discuss this option with your eye care professional before proceeding with LASIK. Section 3 includes discussions about surgical and non-surgical vision correction alternatives. Section 4 reviews guidelines for contact lens patients for the removal of lenses prior to your exam and procedure. Section 5 lists conditions that, if present, may prevent individuals from being candidates for laser vision correction. Section 6 is a written recap of a previous section of this video and describes what to expect on the day of surgery, as well as the steps of the LASIK procedure in detail. Section 7 also recaps an earlier portion of the video and reviews post-procedure medications and restrictions. The next section reviews potential risks and complications of LASIK. The risks of LASIK can be broadly defined in two primary areas: vision-threatening and non-vision threatening. In general, there is about a 1% chance of experiencing some form of side effect or complication either during or following your procedure, but the risk of experiencing a sight-threatening complication are less than 1 in 1,000. If one of these occur, it is possible that there could be loss of some or all of your useful vision in the affected eye. The primary causes are untreated or resistant ocular infection, irregular healing with loss of best-corrected visual acuity, a wrinkling or misalignment of the corneal flap, loss of a non-hinged cap, or malfunctioning of the microkeratome, creating an irregular flap. This risk pertains to flaps created using the microkeratome only, and not those with intralays. Again, these conditions are exceedingly rare and can usually be avoided or managed to prevent marked visual loss. More commonly, patients will experience one or more non-sight-threatening side effects. They are typically short-lived and improve over a period ranging from a few days to several months. I will review in detail the more important points. Discomfort. About 30 minutes following the procedure, as the topical anesthetic begins to wear off, most patients experience some mild to moderate discomfort that lasts from 2 to 6 hours. The sensation is most often described as a burning or stinging sensation and may be accompanied by tearing. This brief period can be adequately managed with the use of a mild pain reliever. Closing the eyes and resting for an hour or two will also typically bring relief. Blurry vision. During the first few days following the procedure, vision may be blurry. Uncorrected visual acuity typically approaches its resultant correction within 3 to 4 weeks following the procedure, with full stabilization reached by the 3-month mark in most patients. During the healing period, some fluctuation in vision may exist. The healing process is very much individualized and varies from patient to patient. Abrasions are probably the most common, yet least appreciated side effect that occur during LASIK. The mechanical action of the keratome as it glides across the surface of the eye has the potential to rub off some of the surface cells of the cornea. In some individuals, this cell layer has poor adherence. When an abrasion occurs during LASIK, it should not prevent you from having an excellent result. However, it can limit visual function for several days to weeks as the abrasion heals. If an abrasion occurs in the line of sight, your surgeon will typically not proceed with the treatment of your second eye until you are comfortable with the vision in your first. When it does not involve the line of sight, you may have both eyes treated. However, there may be more discomfort. In these instances, additional comfort drops are typically given. This risk pertains to flaps created using the microkeratome only, since the potential for abrasions is all but eliminated when intralaser technology is used. Dry eye syndrome is probably the most common postoperative side effect. It is very common for all patients to experience some dryness after the procedure. As a general rule, the dryness lasts 1 to 3 months, but may last longer in some individuals. This condition is typically managed with frequent use of preservative-free artificial tears. When more severe, plugs are inserted to temporarily close the outflow drain for the tears. If you have a history of dry eye syndrome, several tests will be performed during your evaluation to determine its severity. If moderate, intralaser may be preferable since the flap creation is smaller, shallower, and the hinge position can be altered to spare more of the corneal sensory nerves responsible for reflex searing. If dry eye is severe, advanced surface ablations may be preferable. Residual prescriptions. These may take the form of undercorrections, overcorrections, or residual or induced astigmatism. There is no guarantee that, for a particular patient, LASIK will be successful in providing the desired level of vision correction. The chance of being undercorrected increases in cases where a higher amount of prescription is being treated. Conversely, in some cases, there is an overresponse to the treatment resulting in an overcorrection. Fortunately, these overcorrections and undercorrections are anticipated in a small percentage of cases and are usually amenable to a fine-tuning otherwise known as an enhancement. Enhancements are usually not performed until vision has totally stabilized, typically about 3 months after the original procedure. They are commonly performed by relifting the original corneal flap. Assuming that your surgeon or doctor told you that there would be enough tissue remaining to perform additional surgery, you should be able to wear corrective lenses for driving, close work, or other activities until the time of your enhancement. Corrective lenses may still be necessary for good vision and may also continue to be necessary for certain activities if an enhancement is not possible. Again, because intralase allows for the creation of a thinner, more exact corneal flap, patients who have limited amounts of corneal tissue for their prescription will have more tissue available for refinements if they opt for intralase. In some patients, the vision correction effects of the procedure diminish several weeks to months after the surgery. This phenomenon is called regression. Regression is more common in patients who are very nearsighted and is in fact expected as part of the healing process in farsighted patients. In some, but not all cases of significant regression, another LASIK procedure may help to remedy the effect. Diffuse lamellar keratitis, also known as sands of the Sahara, is an inflammatory reaction that takes place under the flap in about 1 in 250 patients. Unlike the case of an infection, patients do not typically have pain and redness. Symptoms include a decline in vision, accompanied by an increase in light sensitivity, and usually occurs from 48 to 72 hours following the procedure. If you experience these symptoms, you will be asked to contact the center or your eye doctor so that you can be seen. Loss of best-corrected visual acuity may occur. Most cases, however, resolve completely without any evidence of past inflammation. Visual irregularities such as light sensitivity, glare, and halos. Some patients may be more susceptible than others to experience night vision difficulties such as halos around lights, glare, and ghosting. These symptoms are caused by corneal irregularities and may be related to pupil size. Halos are specifically caused when the pupil is larger in dim lighting than the area treated by the laser in the center of the cornea. The higher the prescription, the smaller the effective area of treatment, and the greater the potential for halos. If halos persist following LASIK and are problematic, you may get some relief with the use of an eye drop that can be used on a daily basis to help make your pupil smaller. These symptoms usually diminish with time and typically resolve completely by 3 months. In rare cases, they may be permanent. If you are experiencing these symptoms at night with your contacts or glasses, you should expect them to continue after LASIK surgery. Symptoms of halo and nighttime glare have been greatly curtailed through the use of premium laser technology such as Allegretto and Custom View because of the larger diameter of the treatment delivered. This section goes on to discuss a few more considerations and uncommon conditions. Please pause the tape now to read them or make sure to review them prior to signing this page. Section 9 reviews the potential benefits of LASIK, and the 10th and final section contains a series of acknowledgments designed to confirm your understanding of the entire process, your expectations, and our commitment to providing you with the best vision correction experience possible. I hope that you found this video informative and educational. If you have any questions regarding the consent form or any of the other information discussed, please ask your eye care professional or call Millennium. We know that your eyes are precious, and we look forward to providing you with a level of care and service that exceeds your expectations. On behalf of the entire staff at Millennium Laser Eye Centers, we look forward to working with you.